Hi, this is Meredith Zorn, student physical therapist at Rocky Mountain University. Today I'm seeing a patient who presents with left neck and arm pain that goes down to her elbow as well as her first and second digit. Patient did deny any trauma to her cervical spine. She also wasn't able to identify a specific event that could have caused this, other than she did notice some gradual increase in her symptoms the day after she did yard work, which included her lifting some heavy rods. And then within my clinical examination, I did notice some deficits in her cervical range of motion in all planes. I also performed manual muscle tests on both sides, with right being normal and left side being lower or decreased. Mainly I saw 4+ out of 5, and then a 4 out of 5 on her biceps brachii. I also assessed her deep tendon reflexes on both sides, with her right being normal and then left pretty much being normal, except on the biceps brachii. I gave her a 1+ on that one. I also performed a Sperling's maneuver on both sides, and only the left side elicited an increase in her distal paresthesia. I then performed a manual traction on her to see if it correlated with my assumption of what was going on with her, and when I did perform the manual traction, it reduced her symptoms. So with these findings, I concluded that my patient does have a C5-C6 disc herniation, resulting in cervical radiculopathy. And so with that, I will perform cervical traction on her today.
All right, Kayla, so after my clinical examination of you, I have concluded that you do present a C4, C5 radiculopathy. So with that, I do want to start our treatment today using this machine. We call it a mechanical traction machine. What it's really going to do is just help with your symptoms, because you do present a referral pain pattern with like some paresthesia all along your arm. It's just going to help decrease that. So with that, I am going to have to place my hands to different parts of your neck and your shoulder. Are you okay with that?
Yeah, it's okay.
Okay. But before we start, I do want to go over some indications and contraindications.
Okay.
Like I said, because you present a disc herniation, that is one indication that we can use, as well as you having pain in your neck and arm area. But some contraindications that I do want to go over, just to make sure you're safe and clear to use this modality, is, do you have any history of osteopenia or osteoporosis?
Not that I know of, no.
Any steroid use?
No.
I also will be applying a hot pack around your neck. With that, just want to make sure you don't have any impaired sensation in that area. May have cancer,
No.
DVT issues.
No.
Okay, perfect. So with that, we're clear to go ahead and use it. So let me grab that hot pack for you. And I'm just gonna place this right here, so you can go ahead and lie on your back for me. And then you're just gonna place your head right in this flat spot. Yep, you can kind of move your hair to the side. Perfect. Okay. And these little wedges right here to your neck, and specifically placing them in a spot in the bony prominence that we call the Massaro process, but it's really just below your earlobes. So I'm just making sure that those are placed properly and tightly.
Okay.
I'm just gonna, how does this side feel?
Pretty good.
Okay, I'm just gonna see. You tighten a little bit. Is that okay? Okay, go ahead and do this side. Just gonna move your hair slightly. Okay, how's that?
Good.
Okay, so now I'm just gonna go ahead and do the head strap. I'm gonna place this tissue on your forehead, just so the strap isn't gonna irritate your forehead skin.
Okay.
And then I'm just gonna tighten it. So you just let me know if it gets too tight for you.
Okay.
Should just be a nice little snug for you. How's that?
Good.
Perfect. All right, and then I'm gonna put this bolster underneath your knees. So if you can just slip those knees up. Yep, perfect, yeah. Okay. And then I'm gonna place these 2 towels underneath your elbow, one there and one there. Perfect. Comfortable?
Great.
Awesome. some sensation or just some knowing of what you're going to be feeling. So you are going to be feeling a slight tug,
Okay.
or pulling of your head. One thing I want to make sure is that your symptoms don't increase.
Okay.
So for any reason or at any point you feel like your symptoms are getting worse or you just feel uncomfortable, just let me know.
Okay.
I am also going to give you this stop button.
Okay.
So we're just, yep, I'm going to give you that. So again, if you do feel like your symptoms are getting worse or you're just feeling uncomfortable, just go ahead, press that yellow button, and it'll stop.
Okay.
Okay? I'm going to go ahead and connect this machine. Any questions before we get started?
Nope.
Okay. So the machine's on. I'm going to go ahead and do traction for cervical, for manual. We're just going to do this for 10 minutes.
Okay.
And then I will start with 7 pounds. I'm
Okay.
going to slowly bring it up. You just let me know if it's too much pulling or not enough.
Okay.
So how's that right now?
I don't really feel much.
Okay. How about that? Still okay? Like it's pretty comfortable?
Yeah.
Okay.
Okay.
So we're gonna start with that at 10 pounds.
Okay.
And then we're just gonna hit start. So like I said, it's just gonna be slightly pulling on your head
Okay.
and it'll be pulling for 60 seconds and then it'll give you like a 10-second rest where it'll slowly bring it down a little bit.
Okay.
Okay? We'll say 2 minutes has passed. Still feeling okay?
Mhm.
Okay, just making sure. And then we'll say 10 minutes has passed. All right, Kayla, so 10 minutes are done. I'm gonna go ahead and stop this for you. All right, feeling okay?
Mhm.
All right, I'll take this from you, thank you. All right, and then I'm gonna go ahead and unstrap the headpiece first.
Okay.
And then I'll go ahead and loosen the neck wedges. And this side. Okay. And then I'm also just gonna take these towels from you and this bolster. Still feeling okay?
Yeah.
No lightheadedness or nausea or anything?
Oh, that's pretty good.
Awesome, okay. So I'm just gonna help you sit up. Nice and easy. So go ahead, sit it nice and easy for me.
Okay.
You can bring your legs out on this side. Still okay?
Yep.
Awesome. All right. So with that, we'll just go ahead and just end our treatment. Do you have any questions or anything before I let you go?
No, I don't think so.
Okay. Well, great job today, Kayla, and we will see you next time.